Can you hear me? Yes, yes. Inaudible? Still inaudible? Thank you. Ahmed has said that it is I'm audible now. I hope Paramita, if you can confirm if I'm audible. Okay, perfect. Thank you so much. All right. Okay, so about these questions, so these are a mixed pack of questions for from all over pharmacology. These are a few important questions which have been asked before. Thank you. And anyone who's appearing tomorrow, it will be a quick revision for you. But even if you're not appearing anywhere recent, but are still in the process of preparing for pharmacology, these questions will just help you gauge your preparation. So they will give an insight. Good evening, Shafiq. So you just have an insight at what are the important questions you need to emphasize more on. And if you know them, if you don't know them, you can just know for yourself and improve on the areas which you find are slightly weaker on your part, and the ones which are stronger, give yourself a pat on the back, so if you know them already. So we'll be having many such sessions repeatedly, because the more you practice, the rule is more you practice, the more perfection you gain. That's the whole aim of these different MCQs. All right. So as I always say, whenever any question is asked, please attempt to answer. Do not fear whether you will be wrong or right, because this time we are not going to mark you here. This is just for your own practice and to build your confidence. So without any fear of being judged, please mark whatever you feel is right. If you're right, definitely you will gain more confidence. And if you are not right, you will know what the correct answer is. So just do not fear anything and give your answers as in what whenever you think that this is the correct response according to your understanding. Okay, so the first question, and mind you, we've done these before also, but again I want to emphasize there's nothing more important than repetition in pharmacology. So which of the following parameter is used to assess the rate of absorption? So this diagram has been asked quite a lot of times, and which of these parameters do you think can assess the rate of absorption? Tmax, Cmax, half-life, or the area under curve? Ahmed says 2. Okay. Shafiq says 4. Paramita says 4. See, 4 is area under curve and this. Alright, listen, this is firstly what you have to see. Naina says 2, Cmax. Alright, so I'll tell you the correct answer in a while. See, you have to see in the question whether it is asked the rate of absorption or it is asked about the extent of absorption. Okay, Larai says 4. Alright. Now, rate means how fast the absorption is occurring, and extent means to what extent the absorption is taking, how much absorption has occurred. So, rate hamesha kitni jaldi, that means how fast, and how fast is according to what time. Kitni jaldi hua hai, that means that time is important here. So, whenever you are asked about this question and you have been asked about the parameter related to the rate of absorption. Yes, Amrita, very good. Extent is area under curve. So, the extent of absorption hai, that is your area under curve or the EUC. But for the rate of absorption, it is your Tmax. Cmax will only tell you the maximum absorption which has taken place. Okay? But the rate, that means how fast it is occurring, that will be determined by Tmax. So the correct answer here is number 1, which is your Tmax. So this Tmax, the time will tell you about the rate. Cmax is tell you the maximum amount kitna hua hai, or the safety, how much the drug has been absorbed, and area under curve tells you about the extent of absorption. This rate is Tmax, extent is area under curve. Please remember these two things. Rate Tmax, extent, area under curve. These two have been asked quite a lot of times and sometimes confusion occurs. So rate Tmax, okay, and extent, area under curve. Alright, let's go to the second question. A patient consumed 100 tablets of aspirin. This was asked recently in exam. What should be the treatment? Glucagon, sodium bicarbonate, N-acetylcysteine, or ammonium chloride? Three, that is N-acetylcysteine. 3. Nirmala says D, ammonium chloride. Okay, Amit says 3. Radhika says 3. PPP says 2. Nirmala says C, that is N-acetylcysteine. All right. Okay. See, what is the correct answer here? Aspirin का antidote. जो 3 you are telling me, this is the antidote for paracetamol, not for aspirin. ठीक है? So aspirin का antidote is not same as paracetamol. Paracetamol is N-acetylcysteine. Now aspirin is an acidic drug. Aspirin is a acidic drug. So I'm giving you a hint. Aspirin is an acidic drug. So what do you think now should be the antidote for an acidic drug? Or not antidote, or how can you decrease? Very good. 2. Excellent. Sodium bicarbonate. So the correct answer is sodium bicarbonate. So aspirin acidic drug के लिए, if you want to enhance its excretion from the body, so what you do, you can make the urine more alkaline, okay, by giving sodium bicarbonate and enhance the excretion of the drug. Yes, okay. So N-acetylcysteine will be for the paracetamol. So remember that. And glucagon is the antidote for. Can you tell me? Glucagon is the antidote for which poisoning? Poisoning due to which drug? We are going to revise antidotes also after this. But if you could tell me, glucagon is the antidote for which? Very good, Nirmala. It is your beta blockers. So beta blocker poisoning ke liye we can give glucagon. Excellent, Chandani. Excellent, Dr. Parth. Ammonium chloride. Where can you use ammonium chloride? For poisoning with basic drugs. Okay? So you can use ammonium chloride, vitamin C for poisoning with basic drugs. That you can use. Yes. So here the correct answer is, I hope I'm clear, it's sodium bicarbonate. Amphetamines, yes, basic drugs basically. Amphetamine is a basic drug, so any basic drug you can use ammonium chloride. Now these are the list of drugs which are acidic or basic in nature. I'm not listing all the drugs, but few important drugs which have been asked. For example, aspirin, ठीक है, aspirin acidic है, phenobarbital, acetazolamide, phenytoin, warfarin. So any poisoning which is asked that what is the agent that you'll be using when there is poisoning with these drugs, for any acidic drug, you will use sodium bicarbonate. That should be your answer. And for poisoning with basic drugs, we use ammonium chloride. Or what we can use? We can use vitamin C. Okay? And basic drugs is morphine, atropine, diazepam, amphetamine, cocaine. So INE. सबकी spellings में you have INE, 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 except for diazepam, INE. So easier to remember this way. INE except for diazepam. So you can use, yeah, basic drugs. So isme you will use ammonium chloride or you can use vitamin C. Let's go on to the next question. Again, the same question I picked up from one of the exams. It has been asked. So let's solve this. Child ate some seeds or berries of a plant and had dry mouth, difficulty in swallowing, dry flushed skin, fever, difficulty in micturition, dilated pupil, tachycardia. Can you identify? Excellent. No, yes, Amrita is right. It is the Tura poisoning. It is the Tura poisoning. Very good. And the treatment is physostigmine. Very good. Antidote cannot be atropine because the Datura itself is atropine. The Datura poisoning is atropine poisoning. You cannot use atropine in atropine poisoning. So whether it is the Datura, whether it is your atropine, it is one of the same things. Or whether it is belladonna. Okay, belladonna poisoning. Belladonna, atropine, the Datura, everything is the same. So this is the poisoning and the treatment is physostigmine. You can also do cold sponging, diazepam for convulsions, but ultimately the antidote which you have to write is your physostigmine. Okay? So let's quickly revise few antidotes. And you will tell me the antidotes. I'll be writing your answers here. Organophosphate or carbamate poisoning. You will tell me the antidote and I will fill this chart. Yes, please. Very good. Atropine. Excellent, all of you. Atropine is the antidote. जो PAM है, that comes secondary to atropine. Yes, it can be the correct option, but first you have to give atropine and then the pralidoxime. And please remember, if it is a carbamate poisoning, then this PAM doesn't work. It is only for organophosphates. Okay? So remember, if it is organophosphate poisoning, then it is atropine, then you use the oxime. Not first oxime and then atropine. First atropine should come. But if it is carbamate poisoning, only atropine, no oxime. The Datura, belladonna, atropine we just did, it is your physostigmine. You've all answered me. Digoxin, yes, Chandani has answered, digibind. Very good. Beta blockers, Nirmala has answered, glucagon. Excellent. Benzodiazepine, very good, Chandani. It is not fomepizole, sorry. It is flumazenil. Not fomepizole, it is flumazenil in benzodiazepines. Flumazenil. Fomepizole will be for methyl alcohol poisoning. Okay? So it is flumazenil. Very good. Morphine, yes, PPP has written already, naloxone. Very good. Methanol or ethylene glycol. Now, methanol or ethylene glycol poisoning. Yes, Chandni, naloxone is for morphine. Very good. Yes, very good, Amrita. Naloxone. What about methanol or ethylene glycol? Fomepizole. Very good. So there are two. It is fomepizole. Yes, you can also write ethanol. First preference should be given to this and then ethanol. Very good. Now, what about TCA and salicylates? Salicylates हमने अभी किया aspirin. Very good. TCA, salicylates we did अभी sodium bicarbonate. Excellent. Paracetamol, yes. Again, I told you N-acetyl cysteine. ठीक है, N-acetyl cysteine. Next one, let's come to heparin. Yes, please, heparin. Very good, all of you. Excellent work. Heparin. Very good, Naina. It is. Very good, Dr. Parth. Protamine sulfate. Excellent Chandani and excellent Neil. Very good. Protamine sulfate. Warfarin. Very good Chandani. Warfarin है vitamin K. Apixaban. Very good Vineet. Yes, Nayana. Warfarin, vitamin K. Dr. Shaz is right. Vitamin K. Neil is right. Radhika and Nirmala, all of you are very absolutely correct. Sure. Next, the next one is apixaban and rivaroxaban. No, it is not. Chandani, it is not. Yes. Dr. Parth, very good. Andixanet alpha. Andixanet ALPHA needs to have hexane between 10A करके, ठीक है? It's andixanet alpha. Right. Excellent work, Dr. Parth. Dabigatran. Very good, Amrita. For dabigatran, it is idarucizumab. Idarucizumab. Very good, all of you. Amrita, Dr. Parth. Excellent. Cyanide. Idarucizumab, Chandni. Yes. Cyanide poisoning. B12, okay. Amyl nitrate, sodium thiosulfate, yes. So, it is hydroxocobalamin. Then we have, first we should write amyl nitrate. Yes, nitrites. Nitramyl nitrite plus sodium thiosulfate. Yes. Very good. Sure. Next, let's move on to methotrexate. Folinic acid. Yes, folinic acid. Yeah, we can use leucovorin. Folinic acid, or you can use leucovorin. Very good. Then arsenic, mercury or lead poisoning. Yes, folinic acid. Arsenic, mercury or lead poisoning. We can use dimecapral. Right. Penicillamine would be for copper. Okay. Penicillamine would be for copper poisoning. So these are your important drugs and their antidotes. So these are very, very important to know. Okay. For all of the questions asked, 1 or 2 questions are definitely asked from antidotes in some way or the other. So it's a clinical based questions. They give you a child and they narrate the story on what happened to the child. So what will be the antidote? So even they can ask directly agar nahi puchte, so they will give you in a form of a clinical based scenario, but answer would definitely remain the same way you have to answer, right? Alright, next one. Which of the following drugs does not show zero order kinetics? Amrita says C. Vineet says C. Okay, Fomepizole. Yes. TFI says C. Very good. Chandni says C. Nanda says A. Fomepizole C. So most of you are correct. Alcohol shows zero order kinetics. So the correct option is Fomepizole. Okay? It does not show zero order. All the other are classic. Yes. What power mnemonic में देखो, mnemonic में So these are classic, warfarin, ठीक है, alcohol, tall glutamides. So they are classic example of zero order kinetics. Yes, phenytoin has pseudo zero order kinetics, which means initially it follows first order, but as soon as you go increasing the dose of this drug, it follows zero kinetics. And alcohol shows absolute or complete zero order kinetics. Now, what is important to know about this is what are the differences between the first and the zero order kinetics, what you are supposed to know. So first order kinetics and zero order kinetics के बारे में. So the first letter of first is F. So please remember, so here a fraction of the drug is eliminated. Yes, is eliminated per unit time. ठीक है, the unit time है per minute है या whatever is there, per unit time. While in zero order, a constant amount, very good, a constant amount. This is the first major difference in this. First order में, I told you if you have to stand first, half-life के बावजूद, your elimination cannot be constant. You have to clear every exam, that needs to be constant. So the clearance should be constant. So clearance is constant. ठीक है? So in the zero order kinetics, the clearance is inversely proportional to the plasma concentration. You can write it as Cp. Yes. So you have to keep on clearing. To clear every exam, agar first done hai, so the clearance remains constant, while your elimination cannot be constant. If you can't be eliminated in every exam, that cannot happen if you have to stand first. So elimination is directly proportional to, so elimination is directly proportional to the plasma concentration. While zero वाले के लिए क्या होगा, that it is not proportional. So, or you can say the elimination is independent of plasma concentration. Half-life here is constant in the first order kinetics, and here the half-life is variable. Then first order kinetics is followed by, most of the drugs follow this. ठीक है? And very few drugs follow this, and many of them do it at high concentrations. So always remember the exceptions. You don't have to remember the drugs which follow the first order kinetics. So most of the times the question is asked which of the drug follows zero order kinetics, because there are fewer ones to remember. Yes, the watt power, 0 watt power जो भी आपको mnemonic पता है, ठीक है, watt power. So we have warfarin, alcohol, ठीक है. So can you tell me, now can you list the drugs which follow the zero order kinetics? Yes, Nirmala has said W for warfarin. Yes, A stands for? A stands for? Very good. Alcohol. Absolute zero order kinetics. Yes, even aspirin. Not aspirin. Aspirin is a hit and run. Or koi, not aspirin as such. T. T. One T was in the question itself. That was tall glutamide. Not tetracycline. Theophylline, yes. And P stands for phenytoin. So remember these few examples of drugs following zero order kinetics. Okay? Yes, very good. Let's go to the next question. Prescription drugs are included in Schedule H, Schedule Y, Schedule P or Schedule X? Very good, Vineet. Yes, A. Yes, one first is the answer, Schedule H. So again, these prescriptions are, the schedules have been asked time and again. So let's do a quick revision of these schedules. A locked, yes, locked it, Nirmala. Schedule H is prescription drugs. Yes, prescription drugs, and which are sold only on prescription, and the prescription must be written by healthcare providers. Okay, that is why healthcare providers hai. So remember H for healthcare providers, and they jo bhi whatever they prescribe only, then the drugs are dispensed. Schedule G. Okay, so G, remember G stands for under guidance. So they require medical supervision for administration. So they can be given only under medical supervision. Okay? Then Schedule X. X is a danger sign. So they are the psychotropic drugs. Psychotropic drugs होते हैं. For example, we have morphine, and they need to be kept under lock and key. They keep to be kept under lock and key. Okay. Schedule Y. Y is why you are doing this. Okay, you have to prove it. Why the drug is being recommended to be used. So Y के लिए हमें पहले क्या करना पड़ता है? Drug has to undergo various phases of clinical trials to prove itself, to prove its mettle. So therefore, these are the drugs. Yes, guidelines for the clinical trials. P tells you about the life period, the storage, and the life period of the drug, or the storage regulations for the storage and shelf life of life period of the drug. So few important schedules which you should know. Alright. Let's go to the next question. What does the curve 3 represent? What does the curve 3 represent? Inverse agonist, antagonist, partial agonist or agonist? Vineet says antagonist, Dr. Parth says 2 antagonists, Paramita says 3 partial agonists, Nirmala says C. Okay, C means partial agonist. Okay, and Dr. Parth says antagonist. Antagonist. Okay. Right. So the correct answer is curve 3. Curve 3 होगा आपका antagonist. So what is 1? Is full agonist or agonist. Okay, 1 is agonist or full agonist. 2 is working like an agonist, but it has a little less action than the full agonist. So this is called as a partial agonist. Third is your antagonist. No action of its own. antagonist. The fourth is in the opposite direction as the agonist. So this is your inverse agonist. Okay, so these are the four important agonists. These are the ligands, whether it is an agonist or partial agonist, antagonist, or the inverse agonist. Sure. Now another one. Which of the following drugs has a narrow therapeutic range? Which of the following drugs has a narrow therapeutic range? Paracetamol, lorazepam, lithium, or salbutamol? Lithium, Nirmala says lithium, lithium, Dr. Parth says lithium, lithium, very good, all of you. Jessima says lithium, Abdul says lithium. So all of you are absolutely correct. We have a majority here on lithium. So let this be the correct answer. Lithium is a drug which has a narrow therapeutic index. And any drug which has a narrow therapeutic index, it becomes a candidate for therapeutic drug monitoring. So these drugs, they require therapeutic drug monitoring. So to ensure that they follow or they are there in the therapeutic range, because anything, if they fall below their therapeutic range, then what will happen? They will not show efficacy. But if they go above their therapeutic range, then there will be side effects. So to ensure their narrow range, that they stay in the narrow range, we require therapeutic drug monitoring for such drugs. Now, few important drugs which have a narrow therapeutic range, which you can know, is, for example, digoxin has a range between 0.5 to 1.4. Okay? And if the levels go above 2 nanogram per ml, toxicity starts occurring. Lithium, you can straight away remember that the levels should not exceed 1.2. So remember this range. Rather than breaking it up, remember 0.5 to 1.2. And phenytoin, it is 10 to 20 milligrams per deciliter. Theophylline, 5 to 15 micrograms per ml. And valproate, 50 to 100 micrograms per ml. So out of all of them, more questions have been asked on digoxin and lithium. Okay, so all the more reason to remember their ranges. Let's go to this next most asked topic. A patient has glaucoma and is suffering from bronchial asthma also. Which of the following anti-glaucoma drugs should be avoided in this patient? Options are timolol, pilocarpine, bitoxolol, or brimonidine. A. Nirmala says A. All right. Vineet says timolol. Paramita says 4. Brimonidine. Okay. Dr. Parth says 1. All right. Timolol. Abdul says 4. Naina says 1. Okay. Now, out of the, if you're saying 1, you are correct. Timolol is the correct option here. Now, if you see in this question, there are 2 beta blockers. One is timolol and the other is bitoxolol. So why did you not opt for bitoxolol and why timolol? जिन्होंने one answer दिया, you can tell me why did you opt for timolol and not bitoxolol? Because both are beta blockers. So out of the 2, why did you not select? Yeah, beta blocker is contraindicated. Of course it is. So bitoxolol is also a beta blocker. Why did you not mark that? Systemic side effect by topical. Yes. So will bitoxolol not show any systemic side effect? Side effect hota hai because selective. Very good. What do you mean by selective? You are on the right track. Beta blockers. Cardioselective, selective beta blocker. Okay. So timolol is not a selective beta blocker. Beta 1, beta 2 दोनों पे effect है. While betoxolol is a more selective beta blocker. Doesn't have effect on beta 2. But yes, beta 1 only, not on beta 2. So therefore, the chances of it causing problems in the lungs are less. But you should remember that any selectivity is always at a lower dose. If any drug, beta blocker, even if it is selective and it is given in high dose, then the selectivity gets lost. Okay, so you remember that selectivity gets lost at high doses. So if there is no option, let's say the third option, instead of betoxolol, there is some other option. Like a question was asked, was almost asked on the, in anti-rhythmics पे question आया था, and in that there was one of the option was beta blocker and the other option given was CCBs. So वहाँ पे the correct answer was CCBs and not beta blockers, because esmolol was given, and it was many students marked esmolol because they said it is more selective and it doesn't have any effect on the bronchial tree. But the problem is that if you give the drug beta blocker, even the selective one, at a high dose, the selectivity gets lost. So always look for a safer alternative. So let's quickly revise the side effects. Yes, side effects of these drugs are used for glaucoma. Timolol, we have just said that it can precipitate asthma. Okay, one of the major problems with this, it can precipitate asthma. Then it has been associated with stinging sensation in the eye. Stinging sensation in the eye, and it can cause blepharoconjunctivitis. Okay, it can cause blepharoconjunctivitis. Yes, major is precipitates asthma. Yes, latanoprost का prostaglandin analogs, they can cause heterochroma iridis or pigmentation of the iris. Then it can cause growth of the eyelashes. It can cause hypertrichosis, which is the excessive growth of the eyelashes, and it can cause macular edema. It can cause macular edema. Apraclonidine can cause lid retraction and apnea in the neonates. So therefore, it is contraindicated in children of less than 2 years. Acetazolamide can cause corneal edema. One, it can cause corneal edema, and it can also cause ocular allergies. Netarsudil can cause redness of the eye. Redness of the eye, or can cause conjunctival hyperemia. You can also call it as conjunctival hyperemia. While epinephrine is responsible for conjunctival pigmentation. Okay, it is responsible for conjunctival pigmentation. So these are your important adverse effects of the drugs which are used in glaucoma. Okay, so the very important topic, glaucoma, and so please remember all these side effects. Now, I have listed the drugs, and you're supposed to tell me the mechanism of the action of these drugs. So if it is your prostaglandin or F2 analogs, your latanoprostanol, what does it do? Prostaglandin, F2 alpha analogs. What is the mechanism of action of this drug? Yes, so it increases the uveo scleral outflow. Uveoscleral outflow. Pilocarpine, physostigmine, etarsodil. What it does, it increases the trabecular outflow. While the other drugs which are remaining, carbonic anhydrase inhibitors, apraclonidine, brimonidine, beta blockers, dipivefrin, osmotic diuretics, all of them, they are going to do what? They are going to decrease the aqueous formation, the aqueous humor formation. Okay? So they are going to decrease the aqueous humor formation. So these are the important effects of the drugs which are used in glaucoma. So what is the mechanism of action in glaucoma? Next question. A 70-year-old Parkinson's disease patient suffers from bluish discoloration of his legs after taking an anti-Parkinsonian drug. Which of the following drugs can cause this? Levodopa, amantadine, benzhexol, tolcapone. So which of the following drugs which have been listed or given below can cause bluish discoloration of the legs? Amantadine, very good. It is amantadine. So the correct answer is amantadine. So this is the kind of appearance that you see, and this bluish discoloration we call it as livido reticularis. Livido reticularis इसको कहते हैं. And this, you can see the meshwork of these veins, so it looks like, it gives a bluish discoloration to the legs. And the second problem with amantadine is it can cause ankle edema. These two important adverse effects of amantadine you should know: livido reticularis and ankle edema. Okay. Now the other drugs which are used in Parkinsonism. So see, we use the main drug, the most effective drug in Parkinsonism is your levodopa, but it is used along with a dopa decarboxylase inhibitor like carbidopa. So we use a combination of levodopa with carbidopa. Other drugs which can be used are your COMT inhibitors, entacapone and tolcapone. Entacapone and tolcapone, which inhibit the metabolism of levodopa. Then you have your dopamine agonists like ropinirole, okay? Pramipexole, ropinirole, they're all used as dopamine agonists. And your MAO-B inhibitors like rasagiline, okay? Silegiline, rasagiline. So they are the various drugs which are used for management of Parkinsonism. For drug-induced Parkinsonism, the drug of choice is your centrally acting anticholinergics like benzhexol. So they are used only in those cases. Right? So ये overview of the drugs that are used in Parkinsonism. So amantadine also is used here, and amantadine basically is an antiviral drug, but it was found to have an effect in the Parkinsonism also. Now the next one, please. A 20-year-old male visits a center to quit tobacco smoking, which he has been consuming for quite some time. Now, which of the following drugs can be prescribed to him? Whether you will give naloxone, whether you will give fomepizole, whether you will give flumazenil, or whether you will give varenicline. So, which is the correct answer here? Paramita says 4, Vineet says varenicline, Nirmala says 4, Dr. Parth says 4. Very, very good. All of you are absolutely correct. It is varenicline. Okay, so drugs used for smoking cessation. What you have to remember is a mnemonic, very nicotine pro. Just remember very nicotine pro. So very से क्या बन गया आपका varenicline. Nicotine as such, and BOO stands for it is bupropion. ठीक है, so very nicotine pro, varenicline, nicotine, bupropion. 3 important drugs which are used for smoking cessation. ठीक है, next one. Which of the following drugs is available for use as a transdermal patch? Rivastigmine, morphine, meclizine, or atropine? Nirmala says 2, morphine, okay. Paramita says 2. So what about rivastigmine? Why you are not giving me the answer is rivastigmine? What about rivastigmine? Anybody knows what is the use of rivastigmine? Where is it used? Can you tell me where it is used? Rivastigmine? Myasthenia gravis, no. Anti-lipid, no. No. Rivastigmine कौन सी? Anti-lipid disease कौन सी? Alzheimer's, excellent. It is Alzheimer's disease. Alright, so here let me see the correct answer. The correct answer is rivastigmine. ठीक है? Rivastigmine is the Parkinson's में. It is not rivastigmine. Parkinson's में it is rotigotine. I'm going to discuss now the patches also. ठीक है? Important patches. Let's see which are the important patches available. So let's do the first one. You are going to tell me the indication. I'm going to name the patch and you are going to tell me the indication. So हमने rivastigmine अभी किया. That is your Alzheimer's. ठीक है? Alzheimer's disease. Nicotine. Nicotine is for, nicotine patch is for. No, rivastigmine is not for Parkinsonism. It is for Alzheimer's. ठीक है? Nicotine patch for what? Very good. Smoking cessation or tobacco. Can use for smoking cessation. Hyoscine, anti-craving. Hyoscine patch for hyoscine patch for very good motion sickness. Hyoscine or scopolamine, it is motion sickness. Even diphenhydramine, promethazine. Morning sickness, we don't use hyoscine. Morning sickness is doxylamine. ठीक है? Fentanyl, fentanyl patch. Fentanyl. Fentanyl is an analgesic patch for pain. ठीक है? Severe pain, post-op pain वगैरह के लिए we use fentanyl as a patch. Estradiol. Estradiol or estrogen, progesterone patches. Post-op analgesia, yes. Estradiol is for hormone replacement therapy, HRT. Okay, so you can use estradiol for hormone replacement therapy or HRT. Clonidine. Clonidine. Clonidine is used for hypertension. Very good. Hypertension. Rotigotine, I told you right now, the patch is available for Parkinson's disease. Parkinson's disease. Selegiline, as a patch, it is used as an antidepressant. And even for a patch is available for oxybutynine. For oxybutynine के लिए भी एक patch आ गया, which is useful for overactive bladder. ठीक है, overactive bladder. So these are few important patches for the examination point of view. And any list you feel it is there, you can keep on adding to this list. If you, as and when you encounter any patch, उसमें add करते जाओ. So you have a list of drugs available as transdermal patches. ठीक है? चलो, the next question is drug of choice for hyperthyroidism in the first trimester of pregnancy. Drug of choice for hyperthyroidism in the first trimester of pregnancy. Vineet says PTU. Nirmala says C. Okay. Naved says 3. Doc Anshul says 2. Naina says 3. 3. Parameters, Doc Anshul now changed 3. Yes, almost. Everyone is correct. It is propyl thyrosyl or PTU. Okay? So this is the drug of choice. Remember, these are contraindicated. Overall, no. If it is asked you, they still ask you the safest drug in pregnancy without telling you about the trimester, you will still ask. You will still say propyl thyrosyl. But if they have specified the trimesters, then definitely. Second and third trimester mein, then you go in for methimazole and carbimazole. First trimester is only propyl thyrosyl. But if the trimester is not mentioned and they ask you the safest option, then also you should go with propyl thyrosyl only. Because we are more concerned with the organ malformations, and the organ formation takes place in first trimester. So mostly that remains the answer. Okay? So propyl thyrosyl is for the first trimester. And then you can give for the second and third trimester onwards. हम ये दे सकते हैं. But first trimester में these drugs are contraindicated. Okay? So why? Because they have a teratogenic effect. And what is the teratogenic effect of carbimazole and all? So remember the mnemonic cafe. C-A-F-E. Cafe. C for choanal atresia. A stands for, very good, aplasia cutis. So this is like skin is missing, no? This area, aplasia cutis. F stands for fetal goiter, and E stands for esophageal atresia. So cafe, the main teratogenic effects of carbimazole. So if it is given in the first trimester, and if there's a picture shown, then also if you are asked to identify what is the type of teratogenicity, then this is aplasia cutis caused by carbimazole or methimazole. Okay? Alright. Next one. Which of the following is not an adverse effect of digitalis? Which of the following is not an adverse effect of digitalis? Heart block, nausea, vomiting, bradycardia, or red vision? Heart block, nausea, vomiting, bradycardia, or red vision? Which is not? Nirmala says A, okay. Vineet says nausea, vomiting, okay. This is for the first time we are saying that nausea, vomiting is not a side effect. For every other drug, we usually write nausea, vomiting as a side effect. So first time someone saying कि हम nausea, vomiting नहीं करेंगे. Okay, Doc Anshul says 2. Nirmala says earliest is nausea, vomiting. Okay, you're right, Nirmala. The earliest is nausea, vomiting. Rather, the most common side effect with digoxin, the non-cardiac, is nausea, vomiting. Heart block, now it says okay. See, इसमें all are the side effects of digitalis except the last one, which is the red vision. Rather, जो vision defect होता है, there is a vision defect, but it is not the red vision. It has a yellow vision. The vision defect which is seen with digitalis is the yellow vision defect, and the other name is xanthopsia. Xanthopsia. Okay, so this is the other defect. So red vision is not seen with digitalis. Rest all are seen with digitalis. Now, as I said, the earliest and the most common non-cardiac side effect is your GIT side effects like nausea and vomiting. Heart block is also seen with digitalis, and bradycardia is also seen with digitalis. So whether it is your heart block or if it is your bradycardia, the treatment is atropine. So this table is very important. What is the treatment of? So digoxin is a very, very important topic. If it is, whether it is their toxicity, whether it is a mechanism, or whether it is the treatment of the toxicity caused by digoxin itself, everything is important for that. So bradycardia AV block का जो treatment है वो रहता है आपका atropine. So atropine is given. PSVT, the drug of choice here is adenosine. ठीक है, paroxysmal supraventricular tachycardia. You can give adenosine. This is the general treatment of arrhythmias I'm giving. But what अगर atrial arrhythmia, if it is seen in this case, digitalis induced, if it is digitalis induced atrial arrhythmia, then the treatment will be a beta blocker. Atrial arrhythmia, the treatment is beta blocker. This is generally arrhythmia में हम use करते हैं PSVT में adenosine, but अगर आपका digitalis induced atrial arrhythmia है, then you are supposed to give a beta blocker. Similarly, if it is a digitalis induced, this is atrial arrhythmia. If it is digitalis induced ventricular arrhythmia, if it is, digipine is also used. If it is severe toxicity, then you can give digipine. ठीक है, but अगर सिर्फ ये है these ones, then the option is antiarrhythmics, then you give those antiarrhythmics. But yes, severe toxicity के लिए we give digipine. Digitalis induced ventricular arrhythmia, you are right, Nirmala, it is lignocaine. It is lignocaine. But अगर ventricular arrhythmias as such होते हैं, your drugs currently जो हम देते हैं, जैसे ventricular fibrillation है, then you give amiodarone. And lignocaine is given if it is digitalis induced ventricular arrhythmia. वहाँ पे है lignocaine as an option. So remember, अगर ventricular arrhythmias के बारे में they've asked you as such, then your drug of choice or preferred drug is amiodarone. But if it is digitalis induced ventricular arrhythmia, then you use lignocaine. That's the difference I wanted you to know. Severe toxicity, then you will use digibind or digifab. Okay? And remember the toxicity, as we discussed, more than 2 nanograms per ml, your toxic symptoms start. Pregnancy induced hypertension. Which of the following drugs is not used in pregnancy induced hypertension? Am I stuck? Just a second, give me a moment. So, am I stuck? Is my video stuck? No. Alright, atenolol. Is all of you? No, it's fine. Alright. So, yes, the correct answer is atenolol. Alright, thank you. Atenolol is not given in pregnancy-induced hypertension. Why? Because it has been associated with certain fetal malformations. So rest all of the drugs can be given in pregnancy-induced hypertension. So the important thing यहाँ पे जो बात करी थी, the drug of choice. What is the drug of choice in pregnancy-induced hypertension? Can you tell me the drug of choice in hypertension during pregnancy? Drug of choice in hypertension during pregnancy. Very good. It is labetalol. Labetalol by oral route. ठीक है? Let's say eclampsia है या hypertensive emergency in pregnancy. If it is in emergency in pregnancy, then third generation beta and alpha blocker. Okay, that is your labetalol. What about hypertensive emergency in pregnancy? No. N-dipin. What is nicardipin है, nimodipin है, क्या है? N-dipin. Nicardipin you're saying. Okay. No, for emergency in pregnancy, again we will use labetalol, but by IV route. The drug remains the same. ठीक है? Nicardipin is otherwise used, ठीक है? But pregnancy की बात कर रही हूँ मैं, तो वहाँ पे you use labetalol only, but by a different route. ठीक है? All right. Now the next one is, what is the mechanism of action of ezetimibe? Mechanism, yes, image-based questions on app, yes, live, yes, Shobit is on app. Mechanism of action of ezetimibe. B. It is, okay, you're saying B, that is inhibits the release of triglycerides in LDL, alright? B, now it says 1, okay. So, yes, the correct answer is 1. Inhibits the cholesterol absorption. Okay? It inhibits the cholesterol absorption. So, these are your hypolipidemic drugs. I have just tried to briefly put them the mechanism accordingly. The first important are your statins. Okay? The most important hypolipidemic drugs which inhibit the enzyme HMG-CoA reductase, and therefore they cause increase in the LDL receptor levels. Okay? So they are the drug of choice for hypercholesterolemia. Raisins, they also interfere with the enterohepatic cycling of the bile acids. So these are the drug of choice for hypercholesterolemia in pregnancy, because statins can't be used in pregnancy. ठीक है, they are category X drugs, teratogenic drugs हैं. So in case of pregnancy अगर hypercholesterolemia है, then we use bile acid binding resins. Then fibrates, fenofibrate, gemfibrozil, they have the action of PPAR alpha stimulation in the endothelial cells. ठीक है, and they are the drugs which also increase the activity of the lipoprotein lipase, and they have the maximum triglyceride lowering effect. Niacin, high dose of niacin is used here, which inhibits the lipolysis, and they also decrease the flow of free fatty acids to the liver. Ezetimibe, जो अभी हमने पूछा था, because it has been asked before also in the exams, it inhibits this NPC1L1 in the intestine, which is responsible for absorption of the cholesterol from the GIT. So it will inhibit the absorption of the cholesterol from the GIT. That is what is asked. What is the mechanism inhibits the absorption of cholesterol from GIT? Then these are some newer hypolipidemic drugs, and इसमें we have your PCSK9 inhibitor. So this has been recently asked a lot of times in the exams. PCSK9 inhibitors, which is your elirucumab, evolocumab, and inclisiran. So ये question में आया. So please make a note of this. It has been asked. CETP inhibitors, we have anacetrapib. MTP inhibitors, lomitapide. Antisense oligonucleotides against ApoB100, which is responsible when there is accumulation or formation of the VLDL. वहाँ पे mipomersen and monoclonal antibody against ANGPT3L3, Ivana-Qumab. So either you can take a snapshot of this, or if you have already made a table, so remember the mechanisms. So sometimes the questions are asked from the mechanism of action, so you should have a fair idea of how do these drugs act, right? Yes. Very latest FMG question is this one. Which of the following drugs acts at the site marked by a red arrow? So this is your arrow, as shown in the diagram. Aliskiren, ramipril, losartan, or spironolactone? One, aliskiren, yes, very right. This is renin inhibitor, ठीक है? Renin inhibitor है जो works here. So ramipril will act, it is an ACE inhibitor, so they will act at this level. Losartan is an ARB, ठीक है, angiotensin receptor blocker, so it will act, let's say, wherever angiotensin 2 is acting. Let's say these are the receptors, so it is going to act on the angiotensin receptors. And spironolactone is going to affect the aldosterone. The effect of the aldosterone, जहाँ भी होता है sodium retention वगैरह के लिए, spironolactone acts there. So these are the various target sites for the drugs acting on the renin angiotensin aldosterone mechanism. RAS पे. और एक और है, if this point is asked, release of renin can be blocked by beta blockers. You know that beta 1 receptor is present in the JG cells, and when it is stimulated there is release of renin. So release of renin can be blocked by beta blockers. That's the other target site. So 5 drugs can act on the renin angiotensin aldosterone system. And quickly, what are the other diuretics which can act on the various sites? For example, यहाँ पे the drugs acting on the proximal, which diuretic acts on the PCT? Can you please tell me which diuretic acts on the PCT? Thiazides, they act on the DCT. Okay, this is the target sites for thiazides. यहाँ पे. Distal convoluted tubule. Very good. It is carbonic anhydrase inhibitors. Carbonic anhydrase inhibitors. What about the drugs which act on the, here, somewhere in the PCT as well as in the proximal state tubule, or this side, यहाँ पे, you have your osmotic diuretics. ठीक है? Drugs acting here, ascending thick loop of Henle. कौन से? Ascending thick loop of Henle. Loop diuretics. Lasix is the trade name, but they are called as loop diuretics, like furosemide, which is the trade name, which is the the generic name for Lasix. Then on the collecting ducts, यहाँ पे we have the potassium sparing diuretics. Sparing diuretics. So please know the various sites of action on the different drugs. This is important to know. And can you tell me which is the most potent loop diuretic? Most potent loop diuretic? Bumetanide, not furosemide. It is bumetanide. Okay? It is bumetanide. Maximum hypokalemia is caused by, most potent नहीं है furosemide. The most potent is bumetanide. Maximum hypokalemia is caused by, no. It is caused by the drug which acts on the PCT, because that is responsible for maximum reabsorption of sodium. Okay, so this is your carbonic anhydrase inhibitor. Highly ototoxic drug, which is therefore not used currently because of this property, is your ethacrenic acid. Diuretics used for renal failure. Renal failure, loop diuretics. Among the thiazides we can use metolazone. Calcium stones में, diuretics used for the calcium stones because they preserve calcium, don't allow it to be excreted in the kidneys. Thiazides. Okay, the few important pointers. Because thiazides are retaining calcium, they don't allow the calcium to be excreted in the urine, so calcium stones नहीं बनेंगे in the urine, in the kidneys basically. So that is the role they are used for, calcium stones, thiazides, right? All right. So the last question of the day for today, yes, loop uses calcium, yes, definitely. Which of the following drugs is not used in pulmonary hypertension? Which of the following drugs is not used in pulmonary hypertension? Tadalafil, busentin, riociguat, or methyl-dopa? I think it's an easy one. Which is not used in pulmonary hypertension? Yes, Dr. Anshul is absolutely correct. It is methyl-dopa. All the other drugs are used in pulmonary hypertension except methyl-dopa. So, which are the drugs for pulmonary hypertension? Another important question. Yes, methyl-dopa. You are absolutely right. So, the drug of choice are your endothelin antagonists. Okay? Like busentin, okay? Embrisentin. These are all drugs which are the drug of choice for endothelin antagonist, drug of choice for pulmonary hypertension. Then we can use phosphodiesterase 5 inhibitors like sildenafil or tadalafil. Then we have soluble guanyl cyclase activators, riociguat. Prostacyclines like epoprostenol, treprostinil. Prostacyclin or prostacyclin receptor agonists like selexipag. Then continuous nitric oxide inhalation. This was a question in one of the INI set exams. Continuous nitric oxide inhalation is used for which particular disease condition, and the option was pulmonary hypertension. So pulmonary hypertension में हम continuous nitric oxide inhalation भी use करते हैं. CCBs में nifedipine and amlodipine. So these are your drugs which are used for pulmonary hypertension. So with this we come to the end of today's session. So these were the questions we could cover in this particular time. So next time we'll be covering more questions whenever. So I hope you could make use of these revision questions for yourself and assess yourself and gain something also from the class. Okay? Yeah, CCBs. Definitely. Okay, so this is how, in this if you're in the last leg, it is your endothelin antagonists. They are the drug of choice. Bosentan, ambrisentan, these are the drugs of choice. Okay, yes, the first one which I've written, endothelin antagonist. Next class I'll be telling you as and when they are scheduled. For the next month we haven't scheduled yet. So as soon as it is scheduled, it will be put up on the Unacademy channel. So just keep on looking at that, and they will inform you accordingly. Okay. So in the meanwhile, if you are using or you are on the using the free live classes on the Unacademy website, then tomorrow I have an image-based question class at 5:30 tomorrow. So if you can, it's a free class and you can join there, and I'll be discussing all the images which have been asked. So it's a different perspective, the way whatever questions in the past have been asked, they have shown an image and asked questions on that. So I'll be taking up those. So that is, you can do that, right? All right. Thank you so much, everyone, for joining in, and I hope that this was worth your time. And hopefully see you now in the next class. And if all those you who can join tomorrow, and otherwise you can always see the, next time you can come on the YouTube and see the sessions that we're planning for better, more better division and recalls that I'm going to do. So we'll be informing you as and when they are scheduled. Okay, so take care, study well. Thank you so much, everyone, and I'll see you in the next class. Thank you, everyone. God bless.